Tēnā koutou katoa, ko Hamish Wilson toka wingua. Okay, so I'm a practicing GP and I'm also an associate professor at Otago Med School down here in Dunedin, and I've been teaching here since the 1990s. I've been interested in what has been called medically unexplained symptoms for about 40 years now. These are the patients who have symptoms that are not well understood by the medical profession, things like chronic pain, such as complex regional pain syndrome or chronic pelvic pain. There's chronic fatigue syndrome or ME, irritable bowel, non-cardiac chest pain, dizziness, the symptoms that look like urinary or throat infections, but there's no bug there, and so on and so on. So these are all across medicine, these sorts of illnesses. And many patients have, quite short-lived symptoms. But for those whose symptoms become well established, well, it's really awful, really. It can be a real problem living with persistent pain or weakness or bowel disturbance or fatigue, or, these symptoms can really affect people's lives and their work and their relationships. And of course, there's lots of healthcare costs as well. These patients can also be on the receiving end of what's known as stigma or bias, and even sometimes by doctors and other health professionals as well, sort of blamed for their own illness. It's a sort of double whammy, really. No one really offers an explanation for why they're well. And, despite all the health costs, there's no publicly funded clinics for these sorts of patients either, at least here in New Zealand. So that's the background. However, there's two bits of very good news now. The first bit is that modern neuroscience is actually now fully explain all these symptoms and syndromes. It's no longer a mystery once you start looking into it. I've been doing some research on these things for about 5 years now, and I find it really quite exciting because it takes out the mystery. So the explanation is that these sorts of symptoms are disorders of the sensory system. It's kind of a big framework, which explains how pain and other sensations are generated. Now, those things are generated at an unconscious level by the central nervous system. So all body functioning takes place really at an unconscious level. So these disorders are now legitimate ones, just like all other heart, diseases like heart disease and lung disease and so on and so on. That's the first bit of good news. The second bit of good news is that there's many practitioners now who are quite effective in their treatments for these sorts of patients. For example, pain specialists now get really good training about how pain can be persistent and generated by the central nervous system. So their approach is based on modern neuroscience, and their treatment is through explaining to the patient how the sort of pain works. So patients can get their heads around it. They often start to recover as they no longer have, the anxiety that something really, really, really wrong with them. And so their sympathetic nervous system doesn't get fired up, and which in turn can contribute to the symptoms and so on. Other specialists, are also pretty effective now, such as neurologists, and they see lots of these sorts of patients with seizures that aren't epileptic, and tremor that's not Parkinson's, and weakness that's not a stroke, and so on and so on. So their explanation is also based on modern neurosciences as a sort of variation of these disorders of perception. And once again, most of their patients improve with a good explanation. And then the third group is there's lots of private practitioners now who have developed their own treatment protocols for these sorts of patients. And underlying their protocols is modern neuroscience, even if they don't really use that terminology, or may not have even been trained in modern neuroscience, but actually what they're doing is based on that. So Mel Abbott, for example, provides her clients with a really good understanding of the sympathetic nervous system, how it can create symptoms in the body, become a sort of vicious circle of symptoms, to more worry, to more sympathetic nervous firing, to more symptoms, and so on, round and round you go. So I know lots of people who have benefited from Mel's approach, which, as far as I understand it, also identifies any underlying thoughts and beliefs that can feed into how the CNS is sort of unconsciously producing those sorts of symptoms. So having done quite a lot of research on this and creating, quite a lot of work for myself in doing so, but over the last 5 years, these illnesses are no longer a mystery. They're nor is the mechanics of the treatment. So it's no surprise to me that many patients do quite well with these sorts of approaches that Mel's doing. So I'm really positive about the future here. More and more doctors get to understand all this stuff. More of us will know about this, and we've got to become more effective as a profession. We're actually teaching our students about all this down at Otago at the moment. We've developed some resources and some communication skills for that, and we're teaching them how they might explain these illnesses to their patients. What I'd like to see also in the future is more publicly funded clinics for functional neurological disorders and chronic fatigue and long COVID and stuff like that, because once that starts to happen, then these illnesses become more legitimised. In my view, they are legitimised already, because I've looked under the rocks, and there is the answer. So yeah, I'm very positive about where we're going ahead. I think there's lots of practitioners who have been doing these techniques without necessarily being acknowledged as such that they're effective. But to me, it's not a surprise when patients come back and they're better. And I'm always enthusiastic when that happens. And I ask them, gee, that's really good. What happened? What did you learn? What can I learn from that patient? So that's my approach. So happy to chat further, and all the best for the future.